Ms. Jones. My name is Maddie, and I'm going to be your student nurse today. I'm going to pull the curtain to provide her with privacy. I'm also going to provide the appropriate lighting and perform hand hygiene. I'm going to be checking her wristband and asking her to provide her name and date of birth. Can you tell me your name and date of birth? She gives me the correct and appropriate response. I'm also going to be asking her if she can identify her location as well as today's date and the time to ensure that she is cognitively active. Alrighty, can you tell me where you are, and can you also tell me what day it is, and can you tell me what time it is? Patient gives the correct response that she is in Clark County Votech Center and that it is 3 o'clock and today is Friday. She appears to be in no distress. She also shows a good attitude through smiling with verbal and nonverbal communication. She appears to have good hygiene and is well groomed. She is wearing she has on the correct attire for the setting and for the weather. Alright, Ms. Jones, I'm going to be performing your physical assessment, and it may be a little lengthy, so I'm going to ask if you could go use the restroom for me before we get started. And if you need any assistance, let me know. She is able to go use the restroom on her own, and on her way to the restroom, she displays a steady and symmetrical gait, and she also again shows the ability to follow commands correctly and in a timely manner. Alrighty, Ms. Jones, I'm going to start your physical assessment by examining your skin. I'm going to be looking at your left arm here. I examine the skin for any discoloration, lesions, or edema. I'm also going to be checking your circulation, so I'm going to squeeze your fingernail. I check for capillary refill. It is under 3 seconds, and her left arm is clear of any abnormalities. I'm going to be doing the same on the other arm. Her right arm is free of any lesions, discoloration, edema, and I squeeze your fingernail. And capillary refill is below 3 seconds. I examine her skin on her chest, neck, and shoulders. It is free of any lesions, edema, and discoloration. I'm going to pinch your skin here just a little bit. Skin tuger is good. Same on this arm. She appears to be well hydrated, and skin takes its original form quickly. I'm going to do the same for your legs. I examine her legs for any discoloration, edema, lesions, and any other abnormalities. I'm also going to be checking the capillary refill on your toes as well, so I'm going to squeeze your feet, starting with the right leg. Capillary refill is below 3 seconds on both. Skin is warm, dry, and pink in color. Alrighty, I am now going to start checking your pulse. So I'm going to start with your neck here, and I'm going to be pressing on both sides. I'm going to get her carotid pulse, and I am going to check on both sides for symmetry and that both of them are strong. Both sides are even, and there's a good strong pulse. I'm going to be doing the same for the upper part of your elbow here. I check her brachial pulse on each side. They are both strong and symmetrical. I'm going to do the same for your wrist. And I'm now checking her radial pulse. Same on this side. And they are both even and strong on both sides. Are you feeling any pain? Patient states that she is feeling no pain and speaks clearly. Alrighty. I'm going to be feeling the pulse on the back of your leg here. I feel for a popliteal pulse on the back of each of her knees. Both are strong and even. And I'm going to be doing the same for your ankle here. Posterior tibial pulse is strong and even on both sides. And the same for the top of your foot. Dorsal pulse is strong and even on both sides. I'm now going to be listening to your heart. Alrighty, I'm going to warm my stethoscope in case it is cold on her skin. Alrighty, Miss Jones, I'm going to be starting on your right side up here, right below your collarbone. I go to the second intercostal space to check her aorta. Then I'm going to move to your left side, same place. Checking for pulmonary. I'm going to go down a little bit. I go down to the third intercostal to check for her herbs. I'm going to go down a little bit more to the fourth intercostal, listening to her tricuspid valve. I'm going to go just below your breast. To the fifth intercostal left midclavicular line to listen to her mitral valve. While I listen to her mitral valve, I will also get her apical pulse, and I will listen for a full minute for any abnormalities and for a good rhythm and rate. Patient displays no abnormalities and has good rhythm and rate. Alrighty, Ms. Jones. I'm going to now check your respirations. And I'm going to be starting on your right side. I will check for respirations on posterior and anterior side. I'm going to be listening right here, just below your collarbone again on the right side. I listen to her top right lung, and I'm going to ask her to take a deep breath on each area. Can you take a deep breath for me? And let it out. Listening to her left upper lung, deep breath, and let it out. Listening to her right lower lung, deep breath, let it out. And her left, deep breath, let it out. And I'm going to be listening to the base of her left lung. I'm going to go just below your armpit on the inside of your arm here. Deep breath, let it out, and the same for the other side. Checking the base of her right lung. Deep breath, let it out. Respirations sound good. Patient is free of any wheezing, crackles, or any other abnormalities and has a good respiratory rate. I'm now going to ask her if she is able to sit up, and will assist her in sitting up so that I can listen to her posterior lung. Alrighty, Ms. Jones, I'm going to ask if you can sit up for me, and I will be assisting you so that I can listen to your posterior lungs. Patient says that she is able to sit up, but I will be assisting her. I listen to the patient's lungs on her posterior side. I'm going to be listening to the left side right here. Back, top left. Then I'm going to go to the right side. Top of her right lung. Then I'm going to move to the left side, bottom of her left lung, and the right side, bottom of her right lung. And while I have this sitting up, I check for any edema, lacerations, or any other abnormalities. Her skin is warm, good in her skin is warm, dry, and good in color. It is a pink color. Alrighty, Ms. Jones. Her respirations sound good, posteriorly and anteriorly. I'm now going to pull this down a little bit and pull your gown up, and I'm going to be checking your abdomen. I'm going to start by listening to her abdomen for her gastrointestinal sounds. I'm going to start on her right side in the bottom quadrant. I'm going to move up to her left side and to her right side. Abdomen sounds good. Sounds are not hyperactive and not hypoactive. If I could not hear any sounds, I would listen to each one for 5 minutes. I would listen to them for 5 minutes. I'm going to palpate her abdomen to feel for any masses. I'm also inspecting her abdomen while performing to look for symmetry and any other abnormalities, and also assessing her skin. I'm going to be performing range of motion on her to test for her, and also test for her muscle strength. I'm going to start on her left arm. I'm going to be asking you to push up and down against my hands, Ms. Jones. Up, down, and then I'm going to be lifting your arm here, and then at your elbow, and lifting above your head. Range of motion is good on the left side, as well as muscle strength. As you push up, down. Ability is strong and symmetrical on both sides. And then now move to her legs while still providing her privacy. I'm going to ask you to push up with your foot and down. Same on the other leg, and down, and I'm going to ask you to push up with your leg, and down, up, and down. I'm going to then perform range of motion on her left leg. And to her right leg. Patient performs good range of motion, strong and even on both sides. Alrighty, I'm going to be checking her pupils to make sure that they are round, symmetrical, and reactive. I will dim the lights to give appropriate lighting. Alrighty, Ms. Jones, I'm going to be checking your pupils. So I'm going to ask you to look straight ahead, and I'm going to have this light, and it's going to shine in your eyes for just a second. Are you in any pain or discomfort? Patient says that she is still feeling no discomfort and no pain. Pupils are round, reactive, and symmetrical. Alrighty, Ms. Jones, I am now going to test and make sure that you have good circulation and good sensory in all of your limbs. I'm going to do the sharp and dull test on all of her limbs, and ask her to close her eyes and state which she feels. This is sharp, this is dull. Alrighty, I'm going to ask you to close your eyes, and you're going to feel it tap on your left arm, and if you can just tell me which one you feel. Sharp, dull, sharp, dull. And I'm going to do the same for her right arm. Sharp, dull, sharp, and dull. She gives me the appropriate response for both arms and is displaying good sensory and nerve stimulation in both arms. I'm going to do the same for her legs. Sharp, dull, sharp, dull. Moving on to her right leg with eyes still closed. Sharp, dull, sharp, and dull. Patient gives the appropriate response for her lower limbs as well. Alrighty, Ms. Jones, is there anything else I can get for you? And are you in any pain or discomfort? Patient says that she is in no pain and no discomfort. Got the camera.